Well, more and more people, we are finding that people who have recovered from COVID-19 can provide a very valuable contribution after they recover, and also to the treatment of those who are still fighting it. We've talked about something called plasma donations, right? Antibodies from recovered patients and that plasma being used to boost immune response in patients with active symptoms. Our Nora Bettis has this report.
I was, as far as I know, the first person in Corpus who was lucky enough to get the fresh frozen plasma from other patients.
Debra Gunn has had a unique experience, receiving a treatment that potentially saved her life after becoming ill with COVID-19. She says she was shocked to learn she had the virus because her initial symptoms were mild and didn't line up with the standard signs like coughing and shortness of breath.
A week before I ended up in the hospital, I noticed I had like shoulder stiffness, stiff neck. I was using heating on my low back. And I just thought it's because I've been doing some stuff around the house, didn't put it together.
Very soon, however, she suffered from a serious stomach bug and became extremely dehydrated.
So when my daughter came to visit and my son was here also, they both agreed that I needed to go to the ER. I, of course, wanted to argue with them.
She was taken to Corpus Christi Medical Center, Doctors Regional, and her first coronavirus test came back negative. But a scan of her chest revealed something alarming.
My x-ray showed I did have that pneumonia, the one that looks like the crushed glass and everything.
Debra was tested again. This time, it was positive, and she was immediately put on a schedule of treatment, several medications, as well as a donor plasma to boost her antibody response. And after spending a week in the hospital, she got to go home.
I'm just grateful my kids didn't let me stay home, because I probably would have gotten much sicker if I would have.
Nora Bettis, 3 News.